So, temporal region. Today we are going to discuss about temporal region and what are the structures that the temporal region contains. So, coming to the temporal region. So, the temporal region, it is situated on either side of the head. So, the temporal region, it is situated on either side of the head, in front and above the auricle, in front and above. This is the external acoustic meatus, and the temporal region, it is situated on either side of the head and in front and above the auricles. This is the temporal region. Okay, and the floor of the temporal region, we call it as temporal fossa. This is the temporal fossa. So this is the temporal fossa, and the temporal region situated on either side of the head, just above the auricle, just above the in front of the auricle. This is the temporal region, and the floor of the temporal region, we call it as temporal fossa. And the temporal region mainly contains temporalis muscle, temporal fascia, deep temporal vessels and nerves, and auriculotemporal nerve. So these four structures are present in the temporal region. And coming to the temporalis muscle, the temporalis muscle, it is a fan-shaped muscle. So the temporalis muscle, it is here, and it is a fan-shaped muscle, and the fan-shaped muscle, it arises from the temporal fossa. The floor of the temporal region, we call it as temporal fossa. So the muscle itself arises from the temporal fossa and also from the temporal fascia. So the muscle, it is covered by the temporal fascia, and here from there also the muscle originates. So the temporalis muscle, it is a fan-shaped muscle, arises from the temporal fossa, floor of the temporal fossa, and also from the fascia covering the temporalis muscle. So because of this facial and bony origin, it gives the muscle a bipinnate appearance, and this muscle, it is inserted to the coronoid process of the mandible. So see here, this is the head of the mandible, and this is the coronoid process of the mandible, and this is the head of the mandible. See here, you can see the coronoid process of the mandible. So the temporalis muscle get inserted to the coronoid process of the mandible. This is the coronoid process, and this is the head of the mandible. This is the neck of the mandible, and this is the mandibular notch, and this is the coronoid process of the mandible. This is the coronoid process of the mandible. So the temporalis muscle get inserted to the coronoid process of the mandible. So it is a fan-shaped muscle, arises from the floor of the temporal fossa, and also it arises from the fascia covering the temporalis muscle. So because of its facial and bony origins, it gives the muscle a bipinnate appearance, and it passes deep to the zygomatic arch. So we know that. So this is the zygomatic arch. So this is the zygomatic arch, and it passes, this temporalis muscle takes origin here beneath the inferior temporal line. We have superficial temporal lines here and inferior temporal line here, and this muscle passes beneath the zygomatic arch, and it is inserted to the coronoid process of maxilla, coronoid process of mandible. Okay, so it passes beneath the zygomatic arch. The tendon of temporalis passes beneath the zygomatic arch. So it passes like this, and it is inserted to the coronoid process of the mandible. So that is the origin and insertion of the temporalis, origin and insertion of the temporalis muscle. And coming to the action of the temporalis muscle, it elevates the mandible. It elevates the mandible, and the posterior fibers of the temporalis muscle helps in retraction of the mandible. It elevates the mandible, and helps in the posterior fibers, helps in retraction of the mandible. Temporalis muscle on either side helps in side to side movements of the mandible. So that's about the temporalis muscle. Okay. And coming to the next one, that is temporal fascia. The temporal fascia, it covers the temporalis muscle. The superiorly, in the upper part, the fascia is single layered, and it is attached to the superficial temporal line. So in the upper part, the fascia is single layered, and it is attached to the superficial temporal line, and below the fascia splits into two, and it is attached to the outer and inner lips of the upper margin of the zygomatic arch. So this is the zygomatic arch. So coming to the temporal fascia, it covers the temporalis muscle, and above it is single layer and is attached to the superficial temporal line here, and below the fascia splits into two, and it is attached to the upper and lower lips, sorry, outer and inner lips of the upper margin of the zygomatic arch. So that is the attachment of the temporal fascia, and between the two layers of temporal fascia we have branches of superficial temporal arteries and zygomatico-temporal nerve, and the fascia from its deep surface gives origin to the temporalis muscle. The fascia from its deep surface, the temporal fascia from its deep surface gives origin to the temporalis muscle, and the superficial part of the fascia receives an extension from Galea aponeurotica. We know that the scalp consists of layers, and out of this second layer is called Galea aponeurotica, which connects the occipital belly, frontal bellies and occipital bellies, and the superficial layer of temporalis fascia, it receives an extension from the Galea aponeurotica and gives attachment to auricularis anterior and auricularis superior muscles. So that's about the temporal fascia. And the coming to the deep temporal vessels and nerves. The temporalis muscle, it is supplied by the deep temporal vessels and nerves. The deep temporal nerve is a branch of anterior division of mandibular nerve. So the mandibular nerve divides into anterior division and posterior divisions. So the deep temporal nerve is a branch of anterior division of mandibular nerve which supplies the temporalis muscle. And deep temporal artery is a branch of second part of maxillary artery. So nerve is a branch of, the deep temporal nerve is a branch of anterior division of mandibular nerve, and deep temporal artery is a branch of second part of maxillary artery. And coming to the auriculotemporal nerve, the auriculotemporal nerve, it arises by two roots, and the auriculotemporal nerve, it emerges from the base of the parotid gland and it passes behind the superficial artery. So the auriculotemporal nerve, it emerges from the base of the parotid gland. We have parotid gland here like this. So the auriculotemporal nerve, it emerges from the base of the parotid gland. The auriculotemporal nerve emerges from the base of the parotid gland behind the superficial temporal arteries. Behind the superficial temporal arteries, the auriculotemporal nerve emerges from the base of the parotid gland, and it supplies the skin of the temple, and also it supplies the external anterior wall of the external acoustic meatus, and also it supplies the outer layer of the tympanic membrane. So that's about the auriculotemporal nerve. So coming to the infratemporal region. So in the infratemporal region, coming in boundaries of the infratemporal region. So boundaries of the infratemporal region, anteriorly we have posterior surface of the body of maxilla. So this is the maxillary bone. So this is the infratemporal fossa. Here is the infratemporal region is here. Here is the infratemporal region. You can see the infratemporal region here. Here is the infratemporal region, and anteriorly it is bounded by the posterior surface of the body of the maxilla. So this is the maxilla anterior surface and this is the posterior surface. So the anterior boundary which is formed by the posterior surface of the body of the maxilla, and posteriorly it is related to the styloid process. So here is the styloid process of temporal bone. So we can see the styloid process of temporal bone here on either side. This is the styloid process of temporal bone. So anteriorly by the posterior surface of the body of maxilla, anteriorly by the posterior surface of the body of maxilla, and posteriorly by the styloid process of temporal bone, and medially by the lateral pterygoid plate. So here is the lateral pterygoid plate. We can see the lateral pterygoid plate here. So lateral pterygoid plate, we can see it here. Here is the lateral pterygoid plate. So this is the lateral pterygoid plate. This is the lateral pterygoid plate. So the medial boundary is the lateral surface of the lateral pterygoid plate, and laterally by the ramus of the mandible. This is the ramus of the mandible, and laterally by the ramus of the mandible. So anteriorly by the posterior surface of maxilla, posteriorly by the styloid process of temporal bone, and medially by the lateral surface of pterygoid plate, and laterally by the ramus of the mandible, and above it is bounded by the infratemporal region. It is bounded by the infratemporal surface of the, this is the infratemporal surface of the greater wing of sphenoid. Above it is bounded by infratemporal surface of the greater wing of sphenoid, and below it continues with the tissue spaces of pharynx and esophagus. Okay, so coming to the boundaries of the infratemporal region again anteriorly by the posterior surface of the maxilla. So this is the infratemporal region. So here, this is the infratemporal region, right? This is the infratemporal region. Anteriorly it is bounded by the posterior surface of the body of the maxilla, and posteriorly by the styloid process of temporal bone, medially by the lateral surface of the lateral pterygoid plate. Here we can see the lateral surface of lateral pterygoid plate here, lateral surface of lateral pterygoid plate, and medially by the ramus of the mandible, above by the infratemporal surface of the greater wing of sphenoid, and below the infratemporal region it is open and it is continuing with the tissue spaces of pharynx and esophagus. So that's about the boundaries of the infratemporal fossa. And coming to the communications. So communications of the infratemporal fossa, it communicates anteriorly by this is the inferior orbital fissure. So this is the inferior orbital fissure. We have superior orbital fissure above, and this is the inferior orbital fissure. So the infratemporal fossa, it anteriorly it communicates with the inferior orbital fissure, and medially it communicates with the pterygopalatine fossa through pterygomaxillary fissure. So see here, we have pterygomaxillary fissure is here. Pterygomaxillary fissure is here, and medially the infratemporal fossa, it communicates with the pterygopalatine fossa through pterygomaxillary fissure. Anteriorly it communicates with the orbit through inferior orbital fissure, and above and laterally it communicates with the temporal region beneath the zygomatic arch. Above and laterally it communicates with, so this is the temporal region and this is the infratemporal. This is the temporal fossa and this is the infratemporal fossa. So above and laterally it communicates with the temporal fossa, and above and medially it communicates with the middle cranial fossa. See here, we have anterior cranial fossa is here, middle cranial fossa is here, and this is the posterior cranial fossa. So this is the anterior cranial fossa, and this middle cranial fossa, and this is the posterior cranial fossa. So the infratemporal fossa, it communicates medially with the middle cranial fossa through, here we can see a foramen called foramen ovale. We can see the foramen here. This foramen we call it as foramen ovale, and also foramen spinosum. It communicates with the middle cranial fossa through foramen ovale and foramen spinosum. So that's about the communications of the infratemporal fossa. So again, the communications of the infratemporal fossa, anteriorly it communicates with the orbit through inferior orbital fissure, and medially it communicates with the pterygopalatine fossa through pterygomaxillary fissure. Above and laterally it communicates with the temporal fossa, and above and medially it communicates with the middle cranial fossa through foramen ovale and foramen spinosum. So those are the communications of the infratemporal fossa. Coming to the structures present in the infratemporal fossa. Contents. One is lateral pterygoid muscle, medial pterygoid muscle, mandibular nerve, chorda tympani nerve, otic ganglion, and maxillary artery. So coming to the contents of the infratemporal fossa, we have lateral pterygoid muscle, medial pterygoid muscle, mandibular nerve, chorda tympani nerve, otic ganglion, and maxillary artery. So coming to the lateral pterygoid muscle, it arises by two heads, upper head and lower head. So this is the lateral pterygoid muscle, arises by two heads. This is the lateral pterygoid muscle. Okay, it arises by two heads, upper head and overhead. Upper head arises from the upper head arises from the infratemporal surface and infratemporal crest of the greater wing of sphenoid. So this is the infratemporal surface and here is the infratemporal crest of the greater wing of sphenoid. So this is the origin of the upper head. And the lower head arises from the lateral surface of the lateral pterygoid plate. So this is the lateral pterygoid plate and this is the medial pterygoid plate. So this is the lateral pterygoid plate and this is the medial pterygoid plate. So the lower head of the lateral pterygoid muscle arises from the lateral surface of the lateral pterygoid plate and the upper head arises from the infratemporal surface and infratemporal crest of the greater wing of sphenoid. Okay, so this is the upper head and this is the lower head. These two heads, they get inserted here into the neck of the mandible. We have this is the neck of the mandible. So this is the neck of the mandible and we have a depression at the neck of the mandible. We call it as pterygoid fovea. So the lateral pterygoid muscle get inserted to a depression at the neck of the mandible, that is called pterygoid fovea. So the lateral pterygoid muscle arises by two heads, upper head and lower head. Upper head arises from the infratemporal surface and infratemporal crest of the greater wing of sphenoid and the lower head arises from the lateral surface of the lateral pterygoid plate, and they both fibers, the both heads, they pass backward and laterally and they get inserted to the pterygoid fovea, depression at the neck of the mandible. So that is the origin and insertion of the lateral pterygoid muscle. And coming to the action of the lateral pterygoid muscle, it depresses the mandible. The lateral pterygoid muscle, it depresses the mandible and it is one of the important muscles of the muscles of mastication. So the muscles of mastication are four. Muscles of mastication are four in number. One is temporalis, another one is medial pterygoid muscle, and next one is lateral pterygoid muscle and masseter. These are the four muscles are muscles of mastication, and the lateral pterygoid muscle is also one of the muscles of mastication. And this lateral pterygoid muscle, it helps in depression of the mandible, and both medial and lateral pterygoid muscle helps in protrusion of the mandible, and the medial pterygoid muscle and lateral pterygoid muscle alternate actions helps in chewing movements. They helps in chewing of the mandible. So that's about the action of the lateral pterygoid muscle. So the lateral pterygoid muscle, it arises by two heads, upper and lower head. Upper head arises from the infratemporal surface and infratemporal crest of the greater wing of sphenoid, and lower head arises from the lateral surface of the lateral pterygoid plate. Both the muscles, they are inserted to the pterygoid fovea at the neck of the mandible, and the actions of the lateral pterygoid muscle is, it is helps in depression of the mandible, and also it both lateral and medial pterygoid muscles, they helps in the protrusion of the mandible. Alternate actions of both lateral and medial pterygoid muscle helps in side to side chewing movements of the mandible. So that's about the lateral pterygoid muscle. And coming to the nerve supply of the lateral pterygoid muscle, the nerve supply of the lateral pterygoid muscle is by the nerve to lateral pterygoid, which is by the anterior division of mandibular nerve, anterior division of mandibular nerve. Anterior division of mandibular nerve. So, coming to the relations of the lateral pterygoid muscle, the lateral pterygoid muscle has many important relations are present around the lateral pterygoid muscle. So, coming to the relations of the lateral pterygoid muscle, superficial relations, it is related to masseter here, masseter, ramus of the mandible. This is the ramus of the mandible, and the masseter we can palpate it here by clenching our teeth. This is the masseter, and it is related to superficial relations of the lateral pterygoid of the masseter, ramus of the mandible, tendon of temporalis. We know that tendon of temporalis inserted to the coronary process of maxilla, tendon of temporalis, and also maxillary artery. Maxillary artery, it is a terminal branch of the external carotid artery. So those are the superficial relations of the lateral pterygoid muscle. Coming to the deep relations of the lateral pterygoid muscle, coming to the deep relations, it is related to the mandibular nerve and its branches. The mandibular nerve emerges through the foramen ovale here. So this is the foramen ovale here. We can see the foramen ovale here. So this is the foramen ovale here. So this is the foramen ovale here. So the mandibular nerve emerges from the foramen ovale and it forms the deep relations of the lateral pterygoid muscle. Along with the mandibular nerve, we have chorda tympani nerve, middle meningeal artery. Middle meningeal artery, it is a branch of, so here, see, the middle meningeal artery is here. It also forms the deep relation. Middle meningeal artery, which is a branch of maxillary artery, chorda tympani nerve, and also sphenomandibular ligament. The sphenomandibular ligament arises from the spine of the sphenoid. Here we have spine of the sphenoid, and it extends to the mandible. So that is the that forms the deep relations of the lateral pterygoid muscle. So coming to the deep relations of the lateral pterygoid muscle, we have mandibular nerve and its branches. Mandibular nerve arises from the foramen ovale. It comes out from the foramen ovale, and it all middle meningeal artery, chorda tympani nerve, and sphenomandibular ligament. These forms the deep relations of the lateral pterygoid muscle. Coming to the structures emerging from the upper border, we have structures. We have deep temporal arteries and deep temporal nerves. Here I have represented the nerves with the green color. I have represented the nerves with the green color instead of yellow color. So these green color ones, the nerves are deep temporal nerves. So these are deep temporal nerves. Here are the deep temporal nerves, and these are the deep temporal arteries, and also here we can see the masseteric nerve. Masseteric nerve is here. So here is the masseteric nerve. So structures emerging from the upper border are deep temporal vessels and nerves, and also masseteric nerve. Masseteric nerve is a branch of anterior division of the mandibular nerve which supplies the masseter, and deep temporal nerve, they supply the temporalis muscle, and deep temporal arteries, they are the branches of the second part of maxillary artery. Okay, they emerge from the upper border of the lateral pterygoid muscle. Coming to the structures which emerges from the lower border of lateral pterygoid muscle, we have, this is the inferior alveolar. I have already told you that I have represented the nerves with the green color instead of yellow color. So this is the inferior alveolar nerves and arteries. This is the inferior alveolar nerve, and also this is the lingual nerve which emerges from the lower border, and also middle meningeal artery. The middle meningeal artery arises from the lower border of the lateral pterygoid muscle, and again it goes deep to the lateral pterygoid muscle, and it passes upwards to the lateral pterygoid muscle. So middle meningeal artery and accessory meningeal artery, they also emerges from the lower border of the lateral pterygoid muscle. So the structures emerging from the lateral pterygoid muscle are lingual nerve. This is the lingual nerve, and this is the inferior alveolar nerves and vessels. And inferior alveolar nerve, it gives one important branch, that is mylohyoid nerve. This is the mylohyoid nerve, and inferior alveolar artery also gives one important branch, that is mylohyoid artery, which emerges from the lower border of the lateral pterygoid muscle. So this is the relations of the lateral pterygoid muscle. Lateral pterygoid muscle is an important muscles of mastication. It has two heads, upper head and lower head. Upper head arises from the infratemporal surface and infratemporal crest of the greater wing of sphenoid. This is the infratemporal surface. This is the infratemporal surface and infratemporal crest of the greater wing of sphenoid, and the lower head arises from the lateral surface of the lateral pterygoid plate, and this is the lateral surface of the lateral pterygoid plate, and the both heads, they are inserted to the pterygoid fovea at the depression of the neck of the mandible. And coming to the actions, it helps in the depression of the mandible, and both are medial pterygoid muscle and lateral pterygoid muscle helps in protrusion of the mandible, and the muscles, both medial and lateral pterygoid muscle, alternatively they help to side chewing movements of the mandible. And the lateral pterygoid muscle, it is supplied by nerve to lateral pterygoid, which is a branch of anterior division of the mandibular nerve. And coming to the relations, it is related. Superficial relations are masseter. First is here is the masseter, and we have deep to the masseter, we have ramus of the mandible. We know that masseter is inserted here into the ramus of the mandible, and we have tendon of temporalis and maxillary artery, which is a terminal branch of external carotid artery. One of the terminal branches of external carotid artery. And coming to the deep relations, we have mandibular nerve and its branches. Mandibular nerve emerges from the foramen ovale, and also chordae tympani nerve, which is a branch of facial nerve, middle meningeal artery, which also forms the deep relations of the lateral pterygoid muscle, and also sphenomandibular ligament, which extends from the spine of the sphenoid to the mandible inner surface. And coming to the upper structures emerging from the upper border, we have deep temporal vessels and nerves, and masseteric nerve emerges from the upper border. And coming to the structures emerging from the lower border, we have middle meningeal artery is there, inferior alveolar nerves and vessels are there, and lingual nerve. They emerge from the lower border of the lateral pterygoid muscle. So that's about the lateral pterygoid muscle. And coming to the other muscle, that is the medial pterygoid muscle. The medial pterygoid muscle, it is having large deep head and a small superficial head. So coming to the medial pterygoid muscle, the medial pterygoid muscle, it is having large deep head and a small superficial head. It is a quadrilateral muscle. And coming to the deep head, it arises from the medial surface of the lateral pterygoid plate. We have pterygoid plates here. This is the medial pterygoid plate and the lateral pterygoid plate, and the deep head of the medial pterygoid muscle, it arises from the medial surface of the medial pterygoid plate. Okay, and coming to the superficial head, it arises from the tuberosity of maxilla. We have here tuberosity of maxilla is present on the posterior surface of maxilla. So the superficial head arises from the tuberosity of maxilla. They both get inserted to the angle of the mandible. Okay, sir, cough a second. So the medial pterygoid muscle, it arises by two heads, deep head and superficial head. The deep head is comparatively larger and a small superficial head. It is a quadrilateral muscle, and the deep head arises from the medial surface of the lateral pterygoid plate. We have lateral pterygoid plate is here, and this is lateral pterygoid plate, and this is medial pterygoid plate. It arises from the medial surface of the lateral pterygoid plate, and the superficial head arises from the tuberosity of the maxilla here, and pyramidal process of palatine bone is here, and the superficial head is small, and it arises from the tuberosity of maxilla and pyramidal process of the palatine bone. And these two heads, superficial head and deep head, they get inserted. Superficial head and deep head, they get inserted to the angle of the mandible, on the medial surface. This is the angle of the mandible. We can palpate the angle of the mandible here. So the medial pterygoid muscle is inserted here to the angle of the mandible on the medial surface. So that's the insertion of the origin and insertions of the medial pterygoid muscle. Coming to the actions of the medial pterygoid muscle, it helps in assisting, it helps in to assess the elevate the mandible. It helps in elevate the mandible, and along with the lateral pterygoid muscle, it helps in protrusion of the mandible, and also the both muscles alternatively acts, it helps in side to side chewing movements of the mandible. So that's about the actions of the medial pterygoid muscle. And the nerve supply of the medial pterygoid muscle, the nerve supply of the medial pterygoid muscle is nerve to medial pterygoid, which is a branch directly from the trunk of mandibular nerve. So that's about the medial pterygoid muscle. And coming to the mandibular nerve. So the mandibular nerve, it is very important nerve of the head and neck region, and the mandibular nerve arises by two roots. It is the largest division of the trigeminal nerve. We know that trigeminal nerve divides into three: ophthalmic, maxillary and mandibular. Mandibular is the largest division of trigeminal nerve. It has both sensory root and motor root. The mandibular nerve has both mandibular nerve has both sensory root and motor root. The sensory root is derived from the trigeminal ganglion, and the motor root it is derived from the pons. So the mandibular nerve is the largest division of the trigeminal nerve. It has large sensory root and a small motor root. The sensory root it is derived from the trigeminal ganglion, and the motor root it is derived from the pons. These two roots they emerge through the foramen ovale, and after emerging from the foramen ovale from the medial cranial fossa, they unite to form the trunk of the mandibular nerve. And after a short distance, the mandibular nerve divides into anterior and posterior divisions. So the mandibular nerve divides into anterior and posterior divisions. So coming to the anterior division of mandibular nerve. Coming to the anterior division of mandibular nerve, anterior division is mostly motor and a small part is sensory. Anterior division is mostly motor and a small part is sensory, and posterior division is mostly sensory and a small part is motor. So from the trunk of the mandibular nerve itself, both sensory root and motor roots, they unite to form the trunk of mandibular nerve. From the trunk of mandibular nerve, two nerves arises. One is nervus spinosus, and other one is nerve to medial pterygoid. Nerve to medial pterygoid. So from the trunk of mandibular nerve, two nerves arises. One is nervus spinosus, other one is nerve to medial pterygoid. From nervus spinosus, it passes through the foramen spinosum and it supplies the durameter of the brain. And nerve to medial pterygoid, it supplies the medial pterygoid muscle, which has an important muscles of mastication, and also it supplies tensor villi palatinae and tensor tympani by passing through the otic ganglion without interruption. So from the trunk of mandibular nerve, two nerves arises. One is nervus spinosus, which passes through the foramen spinosum and it enters into the medial cranial fossa to supply the durameter over there, and other one is nerve to medial pterygoid. Nerve to medial pterygoid, it supplies the medial pterygoid muscle, and along with the medial pterygoid muscle, it supplies tensor tympani and tensor villi palatinae by passing through the otic ganglion without interruption. So that's about the trunk of mandibular nerve. And coming to the anterior division and posterior division of the mandibular nerve, anterior division of the mandibular nerve is mostly motor and small part is sensory, and posterior division of mandibular nerve is mostly sensory and the small part is motor. So coming to the anterior division of the mandibular nerve, the branches are D, M, D, M, P, B. Okay, so D stands for deep temporal. M stands for masseteric nerve. P stands for nerve to lateral pterygoid, and B stands for buccal nerve. So from the anterior division of the mandibular nerve, four branches comes out. One is deep temporal nerve. We know the deep temporal nerve, they are two in number. They supply the temporalis muscle. And masseteric nerve, it supplies the masseter, and it supplies some articular twigs to the temporomandibular joint. It also supplies the temporomandibular joint. And P stands for nerve to lateral pterygoid, which supplies the lateral pterygoid muscle, which is an important muscle of mastication. And buccal nerve, it is the only sensory part. Here see, the anterior nerve is mostly motor, it supplies the muscle, and a small part is sensory, that is the buccal nerve. This is the buccal nerve. The buccal nerve emerges from the two heads of the medial and lateral pterygoid. So this is the buccal nerve. So the buccal nerve emerges in between the two heads of the upper and lower heads of the lateral pterygoid muscle. It emerges between the upper and lower heads of the lateral pterygoid muscle, and it supplies the skin and mucous membrane over the buccinator and not the buccinator. It supplies only the skin and mucous membrane of the buccinator. So the buccal nerve is a sensory nerve. It is the only sensory part of the anterior division of the mandibular nerve. It supplies the skin and mucous membrane over the buccinator muscle, but not the buccinator muscle. We know that buccinator muscle is supplied by facial nerve. It's a branch of the facial nerve. So that is about the anterior division of the mandibular nerve. So the anterior division of the mandibular nerve, it gives DMPB branches. DMPB branches. D stands for deep temporal. M stands for masseteric. The masseteric nerve, it supplies the masseter by from this deep surface, and it also supplies some branches. It also gives some branches to the temporomandibular joint. And coming to the P stands for nerve to lateral pterygoid, which supplies the lateral pterygoid muscle, and B stands for buccal nerve, which supplies the skin and mucous membrane over the buccinator muscle, but not the buccinator muscle. It supplies only the skin and mucous membrane of the buccinator muscle. So that's about the anterior division of the mandibular nerve. And coming to the posterior division of the mandibular nerve, coming to the posterior division of the mandibular nerve, we have AIL branches. From the anterior region we have DMPB branches, anterior region. From the posterior regions we have AIL branches, and the posterior part is mostly sensory and the small part is motor, that is nothing but mylohyoid nerve. So A stands for auriculotemporal nerve, auriculotemporal nerve. I stands for inferior alveolar nerve, inferior alveolar nerve, and L stands for lingual nerve. L stands for lingual nerve. So these are the three branches from the posterior division of the mandibular nerve. This auriculotemporal nerve, it arises by two roots. It winds down the median meningeal artery, and this auriculotemporal nerve, it emerges from the parotid gland from its base behind the superficial temporal artery. And this auriculotemporal nerve, it is sensory in nature, and it divides into auricular and temporal branches. The auricular branches, they supply the tragus. Here if we have in the auricle, we have tragus is here, and it supplies the auricle and also it supplies the anterior wall of external acoustic meatus, and also it supplies the outer layer of the tympanic membrane. And the auriculotemporal nerve, it gives three distributing branches. One is auricular branches, temporal branches, and articular branches. Auricular branches supply the skin here over the external acoustic meatus auricle, and the temporal branch, it supplies the skin here over the temple, the skin over the temple here. And coming to the articular branches, the auriculotemporal nerve, it also supplies the articular disc and capsule of the temporomandibular joint. So the auriculotemporal nerve, it gives three distributing branches: auricular branches, temporal, and articular branches. So auricular branches, they supply the skin over the auricle, tragus, and also the external anterior wall of the external acoustic meatus, and also they supply the tympanic membrane, the outer part of the outer layer of the tympanic membrane. And coming to the temporal region, temporal branch, it supplies the skin over the temple here, the skin over the temple here. And articular branches, the articular branches mean they supply some joint. Then here, what is the joint present? Here is the temporomandibular joint is there. So the articular branches, they supply the temporomandibular joint. And also the auriculotemporal nerve, it carries the postganglionic parasympathetic fibers from the otic ganglion and supplies the secretomotor innervation to the parotid gland. That means it communicates with the otic ganglion. It carries postganglionic parasympathetic fibers. It carries postganglionic parasympathetic fibers from the otic ganglion, and it also supplies the secretomotor innervation to the parotid gland. And also it carries postganglionic sympathetic fibers and supplies the vasomotor innervation to the parotid gland. So auriculotemporal nerve has communications with the otic ganglion, and distributing branches are here: auricular, temporal, and articular. That's about the auriculotemporal nerve. And coming to the inferior alveolar nerve, inferior alveolar nerves and vessels, they emerge from the lower border of, here is the inferior alveolar nerve. It emerges from the lower border of the lateral pterygoid muscle, and it is mostly sensory in nature. Inferior alveolar nerve, it is mostly sensory, and it gives one important branch, that is mylohyoid nerve. Mylohyoid nerve, it is the only motor part of the posterior division of the mandibular nerve. This mylohyoid nerve, it supplies the mylohyoid muscle, and along with the mylohyoid muscle, it also supplies the anterior belly of digastric. We know that anterior belly of digastric is situated here on either sides, and we have posterior belly of digastric is here. And this anterior belly of digastric and posterior belly of digastric, they are connected by an intermediate tendon. So the anterior belly of digastric, it arises from the digastric fossa here. here from the on the medial surface of the mandible. So the mylohyoid nerve which arises from the inferior alveolar nerve, which is the only motor part of the posterior division of the mandibular nerve, it supplies the mylohyoid muscle and also it supplies the anterior valley of digastric. The inferior alveolar, and that's about the inferior alveolar nerve. And one more point about the inferior alveolar nerve, it supplies the skin and adjoining gums of the premolar teeth, molar teeth and the incisive and canine teeth. And the inferior alveolar nerve, it gives incisive nerve, mental nerve. Here the inferior alveolar nerve, it enters into the mandibular canal here. Here we have a foramen here and this is the mandibular canal. So the inferior alveolar nerve, before entering into the mandibular canal, it gives mylohyoid nerve, and in the mandibular canal it gives branches and to the premolar, the skin and the mucous membrane of the premolar and molar teeth, here adjoining gum of the premolar and molar teeth, and it also gives the incisive nerve and mental nerve. Incisive nerve, it supplies the adjoining gums of the incisive and canine teeth, and mental nerve, it emerges from the mental foramen here from the mental foramen is here, and it emerges from the mental foramen and supplies the skin over the chin. So that's about the inferior alveolar nerve. So the inferior alveolar nerve, it is a posterior region of the mandibular nerve, emerges from the lower border of lateral pterygoid muscle, and it gives one important branch, that is mylohyoid nerve, before entering into the mandibular canal here. This is the mandibular canal. So before entering into the mandibular canal, the inferior alveolar nerve gives mylohyoid nerve. The mylohyoid nerve, it is the only motor part of the mylohyoid nerve, it is the only motor part of the inferior alveolar, that is also posterior division of mandibular nerve, and this mylohyoid nerve, it supplies the mylohyoid muscle along with anterior belly of digastric. And coming to the inferior alveolar nerve, in the mandibular canal, it gives branches to the premolar and molar teeth and supplies the adjoining gums of the premolar and molar teeth. It also gives incisive nerve, which supplies the mucous membrane and adjoining gums of the canine and incisors teeth. And mental nerve, it emerges from the mental foramen and supplies the skin over the chin. Though that's about the inferior alveolar nerve. And coming to the last branch of the posterior region of the mandibular nerve is the lingual nerve. So the lingual nerve, it also emerges from the lower part of the lateral pterygoid muscle. The lingual nerve, it carries general sensations from the anterior 2/3 of the tongue, and lingual nerve, we can palpate the lingual nerve in the third molar teeth, 1 cm below the third molar teeth. It is covered by the mucous membrane. We can palpate the lingual nerve 1 cm below the third molar tooth. And coming to the branches of the lingual nerve, internal nerve communicates with chorda tympani nerve, and also it communicates oxalopsis. So coming to the third branch of the posterior region of the mandibular nerve, that is lingual nerve. The lingual nerve, it provides general sensation for the anterior 2/3 of the tongue. For anterior 2/3, it provides general sensation. And the lingual nerve, it communicates with chorda tympani nerve, and along with the chorda tympani nerve, the lingual nerve, it supplies the anterior 2/3 of the tongue. For taste sensation is by chorda tympani nerve, and it also supplies, and it also connected to the submandibular ganglion. The lingual nerve, it also connected by the submandibular ganglion by 2 roots. This submandibular ganglion rests on hyoglossus muscle, and through this, the lingual nerve, it supplies secretomotor fibers to the submandibular and sublingual glands. So, communicating branches of the lingual nerve communicates with chorda tympani nerve and also submandibular ganglion. So, the chorda tympani nerve carries the taste sensations of the anterior 2/3 of the tongue, and from the submandibular gland, this submandibular gland, it is suspended from the lingual nerve by 2 roots, and this submandibular ganglion, it carries the so The lingual nerve communicates with chorda tympani nerve and submandibular ganglion. The submandibular ganglion, it is suspended by lingual nerve by two roots on the hypoglossal muscle and suspended by two roots by the submandibular ganglion, and the from the submandibular ganglion, the lingual nerve, it supplies secundomotor innervation to the submandibular and sublingual glands, and the lingual nerve also communicates with the hypoglossal nerve, which carries proprioceptive sensations from the tongue muscles. So that's about the lingual nerve. So that is about the mandibular nerve. So the mandibular nerve, it divides into anterior division and posterior division. Actually, the mandibular nerve has a larger sensory root and a smaller motor root. Sensory root is derived from the trigeminal ganglion and the motor root derived from the pons, and these roots, they comes downwards from the foramen oval, and these roots, they unite and they form the trunk of the mandibular nerve. From the trunk of the mandibular nerve, two nerves arises, nervus spinosus and nerve to medial pterygoid. Nervus spinosus, which pass through the foramen spinosum and supplies the middle cranial fossa, the dura mater over the middle cranial fossa. And coming to the nerve to medial pterygoid, supplies the medial pterygoid muscle, which is an important muscle of one of the muscles of mastication, and it also supplies the tensor tympani and tensor palatine by passing through the otic ganglion without interruption. And coming to the anterior division is mostly motor and a small part is sensory, that is buccal nerve, DFPB. From the anterior division, four branches arise: deep temporal, masseteric, nerve to lateral pterygoid, and buccal. Buccal is the only sensory branch, and it supplies the skin and mucous membrane over the buccinator muscle, but not the buccinator muscle. And coming to the posterior division, it gives three branches: auriculotemporal, inferior alveolar, and lingual. Auriculotemporal, it is supplies the skin here over the auricle and also skin over the temple, and it supplies the articular branches to the temporomandibular joint. And inferior alveolar nerve, it gives one important motor branch, that is the only small motor branch, that is mylohyoid nerve, which supplies the mylohyoid muscle and also anterior belly of digastric. And inferior alveolar nerve, it supplies the adjoining gums of the mucous membrane of the adjoining gums of the premolar, molar, incisive, and canine teeth. And it also gives mental nerve, supplies the skin over the chin. And coming to the lingual nerve, we can palpate the lingual nerve behind 1 cm below the third molar tooth, and this lingual nerve gives a general sensation for the anterior 2/3 of the tongue, and it communicates with chorda tympani nerve and submandibular ganglion. Through the chorda tympani nerve, it conveys the taste sensation, and to the submandibular ganglion, it carries a secretomotor innervation to the submandibular and sublingual glands. It also communicates with the hypoglossal nerve. Lingual nerve, it also communicates with the hypoglossal nerve, which carries proprioceptive sensations from the from the tongue muscles. So that's about the lingual nerve. So that's about the mandibular nerve. And coming to the other content of the other content of the infratemporal fossa, we have chorda tympani nerve. Chorda tympani nerve, we know that it is a branch of facial nerve. The chorda tympani nerve, it arises from the facial nerve 1 cm 6 mm above the stylomastoid foramen. We have stylomastoid foramen is here. Usually, the stylomastoid foramen is present between the styloid process and the mastoid bone. We have stylomastoid foramen is there. We can palpate the mastoid process behind our auricle, and so the stylomastoid foramen, above 6 mm above the stylomastoid foramen, the chorda tympani nerve arises from the facial nerve, and it passes in between the mucous and fibrous layers of the tympanic membrane, and it enters into the infratemporal fossa by the petrotympanic fissure. It enters the infratemporal fossa at the petrotympanic fissure here. And coming chorda tympani nerve, so chorda tympani nerve, it is an important content of the infratemporal fossa. It arises from the facial nerve and above the 6 mm above the stylomastoid foramen, and after that it passes in between the fibrous layer and mucous layer of the tympanic membrane, and it enters the temporal fossa, infratemporal fossa through petrotympanic fissure is here. Petrotympanic fissure, we have petrous part of temporal bone is here, and it enters the petrotympanic fissure will be here. And the chordae tympani now, after emerging from the lateral pterygoid muscle, it passes downwards and forwards beneath the lateral pterygoid muscle, and later it joins with the lingual nerve. It joins with the lingual nerve at an acute angle, and it conveys the fibers for the anterior 2/3 of the tongue taste sensation. Okay, so that's about the chordae tympani now. So, and coming to the otic ganglion. Otic ganglion, it is situated just below the foramen oval. We have foramen oval is here. The otic ganglion is situated just below the foramen oval and medial to the mandibular nerve. The otic ganglion communications are: it carries preganglionic fibers. Preganglionic parasympathetic fibers. So the otic ganglion, it carries preganglionic parasympathetic fibers. It receives preganglionic parasympathetic fibers from the inferior salivatory nucleus and from the tympanic branch of glossopharyngeal nerve, tympanic plexus, and also lesser petrosal nerve. So the preganglionic parasympathetic fibers arises from the inferior salivatory nucleus and they pass through the tympanic branch of glossopharyngeal nerve. So the otic ganglion, it is functionally related to the glossopharyngeal nerve and structurally it is related to the mandibular nerve. Tympanic branch of glossopharyngeal nerve. So the preganglionic parasympathetic fibers, they arise from the inferior salivatory nucleus and they pass through tympanic branch of glossopharyngeal nerve and they form tympanic plexus here, tympanic plexus, and from the tympanic plexus lesser petrosal nerve arises, and to the lateral petrosal nerve it relays in the preganglionic parasympathetic fibers, they relay in the otic ganglion. They relay in the otic ganglion. So the otic ganglion, it communicates with the preganglionic parasympathetic fibers which arise from the inferior salivatory nucleus and from the tympanic branch of the glossopharyngeal. From the tympanic branch of glossopharyngeal, the preganglionic parasympathetic fibers, they form tympanic plexus, and from the tympanic plexus they supply the lesser petrosal nerve, and from the lesser petrosal nerve they relay in the otic ganglion. So the otic ganglion, it is situated in front of the mandibular nerve, just medial to the mandibular nerve. It is 2 to 3 millimeters in diameter, and from the otic ganglion the postganglionic parasympathetic fibers, they carry through auriculotemporal nerve and they supply the parotid gland, secretomotor innervation to the parotid gland. So that is the preganglionic parasympathetic innervation. And coming to the postganglionic sympathetic fibers, we know that the preganglionic sympathetic fibers, they relay in the three ganglions here. There will be superior cervical ganglion, inferior cervical ganglion, middle cervical ganglion. These are the sympathetic ganglions. The postganglionic sympathetic fibers, they come out from the superior cervical ganglion, middle and inferior cervical ganglion by forming plexuses around the middle meningeal artery, and they also relay in the otic ganglion, and they are carried out by the auriculotemporal nerve. So those are the communications of the otic ganglion, and the otic ganglion, it also receives a communication from the chordae tympani nerve, which is an alternate pathway for the taste sensation of the anterior 2/3 of the tongue. So the otic ganglion is an important structure of the infratemporal fossa. It is situated below the foramen oval, medial to the foramen oval is here. It is situated below the foramen oval. It is 2 to 3 millimeters in diameter and in medial to the mandibular nerve. And the otic ganglion, it receives preganglionic parasympathetic fibers here and they relay in the otic ganglion. And the postganglionic parasympathetic fibers, they supply through the auriculotemporal nerve. They supply the auriculotemporal nerve. They supply parotid gland, secretomotor innervation to the parotid gland. And coming to the postganglionic sympathetic fibers, they also pass through this ganglion without interruption by forming plexuses around the arteries, and they also supply the auriculotemporal nerve. And this otic ganglion, it receives a communication from the chorda tympani nerve, which is an alternate pathway for the taste sensation of the tongue. So that's about the otic ganglion. And coming to the other content of the infratemporal fossa, that is the maxillary artery. So another contents of the infratemporal fossa, that is the maxillary artery. Maxillary artery, we know that it is a terminal branches, largest terminal branch of external carotid artery. Maxillary artery is a largest terminal branch of external carotid artery, and the maxillary artery, it is divided into three parts by the lateral pterygoid muscle. This is the first part. The part which is above the lateral pterygoid muscle is the second part, and this is the third part. So first part, second part, and third part. So coming to the first part of the maxillary artery, 5 branches come out, damage. 5 branches come out from the first part of the maxillary artery, that is damage, D-A-M-A-I, damage. And the second part of the maxillary artery, first part of the maxillary artery, 5 branches comes out, that is damage. And from the second part of the maxillary artery, this is the which is above the lateral pterygoid muscle, that is which is above the deep head of lower head of lateral pterygoid muscle, is the second part. This is the maxillary artery. From the second part, we have DMPB, like the anterior region of the mandibular nerve. The mnemonic is same, DMPB, like the anterior region of the mandibular nerve. And from the third part, we have pig pass, P-I-G-P-A-S, pig pass. So the first part we have DMPB, damage, from the first part we have damage, from the second part we have DMPB, and third part we have pig pass. So coming to the first part, 5 branches arise from the first part. D stands for deep auricular, A stands for anterior tympanic, M stands for middle meningeal artery, A stands for accessory meningeal artery, and I stands for inferior alveolar artery. So these are the 5 branches from the first part of maxillary artery. So deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar. So we can see the 5 branches here. This is deep auricular, this is anterior tympanic, this one is middle meningeal, accessory meningeal, and inferior alveolar. These are the 5 branches from the first part of the maxillary artery. Okay, so damage, deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar, damage. And from the second part, we have 5 branches like the mandibular nerve. That means here we can spell it as arteries instead of nerve. So deep temporal arteries, masseteric artery, pterygoid artery, and buccal artery. So from the second part, 4 branches arises. See here, from the second part, this is the masseteric artery. Okay, this is the buccal artery. Okay, next this is the deep temporal artery. We can see the deep temporal artery here. So deep temporal artery, masseteric artery, and we have pterygoid arteries is here, pterygoid artery and buccal artery. So 4 branches arises from the second part of maxillary artery, DMPB. First part damage, second part DMPB, and third part is pig pass. So third part. From the third part, coming to the third part of maxillary artery, we have pit pass. First one is posterior superior alveolar artery, and next one is infraorbital artery, greater palatine artery, greater palatine artery, pharyngeal artery, artery of pterygoid canal, and spino-palatine artery. So these are the 6 branches from the third part of maxillary artery. We can see the branches here. So this is the third part of maxillary artery, which emerges in between the 2 heads of the lateral pterygoid muscle. Third part of maxillary artery. We can see the branches here. We have posterior superior alveolar artery is here, and infraorbital artery is here. This is the infraorbital artery. And next is the greater palatine artery is here. So posterior superior alveolar, infraorbital and greater palatine. And we have artery of pterygoid canal is here, pharyngeal artery is here, and spino-palatine artery is here. These are the 6 branches from the third part of maxillary artery. So the maxillary artery is one of the terminal branches of the largest terminal branches of the external carotid artery, and when by the lateral pterygoid, the deep head of lateral pterygoid muscle, lower head of lateral pterygoid muscle, the maxillary artery divides into 3 branches. First part, second part, and third part. First part up to the lower border of muscle. This is the first part. It gives 5 branches, that is damning, D for deep auricular, A for anterior tympanic, M for middle meningeal, A for accessory meningeal, and I for inferior alveolar. And from the second part, 4 branches, that is DMPB, which regards to the from the anterior division of mandibular nerve, the mnemonic also DMPB. And from the second part lies about the lower head of lateral pterygoid muscle. We have deep temporal, D stands for deep temporal, M for masseteric, P for pterygoid artery, and B for buccal artery. And from the third part, pit pass, 6 arteries arise from the third part. Posterior superior alveolar, infraorbital, greater palatine, pharyngeal, artery of pterygoid canal, and spino-palatine artery. So this is about the maxillary artery, which is also an important content of infratemporal fossa. And coming to the other content of infratemporal fossa is pterygoid venous plexus. Pterygoid venous plexus is also content of infratemporal fossa. This pterygoid venous plexus, it situated around the lateral pterygoid muscle. It is situated around the lateral pterygoid muscle. This pterygoid venous plexus is a plexus of veins which communicates with the inferior ophthalmic veins, and they also communicates with the cavernous sinus through the emissary veins which pass through the foramen ovale, and they also communicate, this pterygoid venous plexus communicates with the facial vein through common facial vein. So the pterygoid venous plexus, it communicates with the inferior ophthalmic veins through the infraorbital fissure, and they communicates with the inferior ophthalmic veins, and they also communicates with the cavernous sinus, and they also communicates with the facial vein. So these pterygoid venous plexus situated in and around the lateral pterygoid muscle, and this, because of this rich venous plexus, this pterygoid venous plexus, it acts as peripheral heart during to supply stagnant venous blood flow through when we yawn. During yawning, this pterygoid venous plexus acts as peripheral part to supply the stagnant venous flow. So this pterygoid venous plexus, it acts as peripheral heart to supply stagnant venous flow during yawning. So it communicates with the inferior ophthalmic vein, cavernous sinus, and also facial vein through common facial vein. This is also content of the infratemporal fossa. So that's about the infratemporal fossa. In the infratemporal fossa, we have discussed about medial pterygoid muscle and its relations, lateral pterygoid muscle and its relations, mandibular nerve and its branches in detail, chorda tympani nerve, otic ganglion, maxillary artery and pterygoid venous plexus. These are the contents of the infratemporal fossa. So that's about the infratemporal fossa.